Today we'll be talking about the blood pressure tracker monitoring system. Nebraska Health and Human Services and the Women's and Men's Health programs recently got together to discuss how to come up with a tool that our clients can use to track and monitor their blood pressure. In the past, our clients have used the check change control tracker system through the American Heart Association. American Heart Association stopped funding or supporting the online tracker system December of 2020. So we got together with our internal IS&T and developed a blood pressure tracker monitoring system using REDCap. So today I'll be going over how to find it, how to use it, and how best to utilize the tools. The flyer here is something that clinics, health departments, anybody can really use to hand out to clients if they want. It's really a general synopsis of the tracker system. So it's an online tracking system that will track and monitor your blood pressure, communicate and connect with a health coach, and provide educational information. Simple steps on how to use the tool. They need to log into the system, enter their demographic information. Once information is submitted, the staff will then assign a health coach based on their location that they're at within the state. Once a health coach is assigned, an email then with links will be sent to the client so that they can start entering their blood pressures. Once a client does enter their blood pressures, those will then be sent to their assigned health coach. And then the system then sends a reminder every couple of days to the client so that they can enter their blood pressures. You can find the blood pressure tracker on our Community Health Hub page. And I will go there next. One thing that we did also develop is an online, handbook of how to use the system. So ways to access, and then when a client enters their information, how to go about entering that information. We also included how to assign a health coach, so that is there as well. And then once the client does get the email that says they're able to start entering their blood pressures, what that email looks like and how to go about entering those blood pressures. We've also included information on communication back and forth from the health coach to the client. And we've also included any information on health coach notes. And we'll go into a more, in-depth look at how to use the tracker in just one moment. All right. So in order to access, you're going to go here to our Community Health Hubs page. And there's a box right here kind of in the middle of the screen that says Blood Pressure Tracker Monitoring System. Currently, it's only available in English. And I think once we start using it and we get a lot of client information in there, and if there is a high need for Spanish, then we'll look at adding a Spanish component. But for right now, it is only in English. So you're going to click here and enroll now. The first part of the information that's on the tracker system is really kind of just a welcome, that it's an online tool that will help the client with their blood pressure and monitoring over a period of time. And then we just really talked about the importance of knowing your numbers and monitoring. Again, we just kind of had some simple steps on how to use the tracker. So I'm going to go ahead and start entering some demographic information. So we really want, and I'm just going to put in their test for now, first name, last name, date of birth. There is a little helpful hints underneath of how to enter the date of birth. So you're going to want to enter month, date, and the year. Address, Lincoln, Nebraska. If any of these fields are not filled out, there will be an error message at the very end. So they wouldn't be able to, I guess, go to the next page if they didn't have things filled out. Email address is going to be important. One thing with the email, if you have a client that doesn't have email, one thing that you can do is, as an organization or clinic, you can go ahead and enter your email address. So the health coach, potential health coach information. So that way, if that client doesn't have an email, you'll get the notices that, hey, Jane needs to enter a blood pressure. And then you'll know to give her a call and let her know, hey, we need you to go to Walgreens so that you can get 2 blood pressures, and then you can call me, or we can talk through it and get those entered into the tracking system. So there is kind of a little bit of a workaround if they do not have an email address. Gender, Hispanic, primary language. Then we go into the health history. Do you currently see a medical provider for your blood pressure? A simple yes, no. Are you currently taking medications for your blood pressure? Yes, no. If they do hit yes, there is a box here that says list of medications, and they don't necessarily need to know what their dosages are, but this would be an opportunity to enter any medications that they're taking. Date of their last provider visit, if they know it, and then who referred them to this tracker. Every Woman Matters Women's and Men's Health Program is an option. If they do hit local health department or medical clinic, there will be a drop down, so then they can put in the name of their health clinic. Okay, and then once they hit submit, it'll go through and it'll say, thank you for filling out the demographic information. Your request has been sent to the Blood Pressure Tracking Administration, which really essentially is the central office. Once we assign a health coach, they'll receive an email with a link to begin blood pressure tracking. All right, so that's how that works. Once a client submits or sends in that demographic information, this information here will be sent to our central office, the EWM email address. What comes into our office is really this, please fill out health coach information. And we do have staff that are monitoring this. So central office staff then will click on the link. The information that's really given, and that is the very basic information: client name, address, email, language, and the county. So based upon the county or where that client lives is how we will then assign out the health coach. So if Elkhorn-Logan Valley, if this client lives in the Elkhorn-Logan Valley area, there's 4 counties. So if that client were in Cumming County, we would know then to assign that client to an Elkhorn-Logan Valley health coach. But for the purposes for today, we're going to go ahead and just assign to our central office staff. Select the health coach email address, and whoever your health coach is, there should just be the one email address to select, as well as the health department or the organization. Hit next page. And then the date of the contact, which would be like today's date. Today's the date that I'm going to assign this health coach to this, or to assign this client to the health coach. And then if I want to put a note to the health coach, I might just say, new client interested in monitoring blood pressure from your coverage area. And typically we probably wouldn't use this, but if we felt that there was a need to put a message to the health coach, we would certainly put it there. I'm going to go ahead and submit and close the survey. So then, as a client, and hopefully this will come through, I'm going to get this email. And this email basically is going to say, this tracker is an online tool to help you monitor, kind of that same information that was on the beginning page of the tracker. And then there's going to be these 2 links. These links are unique to the client. and it shouldn't be forwarded to anybody else. So the client then is going to click on the link and it's going to take them to this page. Blood pressure tracker, next page. Here's where they're going to enter their blood pressures. So let's say they had, 191 over, or even let's just say 100 over 160. That's going to be a category 4 blood pressure, which is hypertensive crisis. Let's say their next one is 72 over 119. That's going to be a 3, which is hypertension stage 2. Anytime that a client were to enter a blood pressure that is in the hypertension stage 2 or the hypertensive crisis, that's category 3 or 4, this red note down here will pop up that says that they're category 3 and 4 and that they need medical attention. Please call your healthcare provider right now to report your blood pressure readings. So like I said, anytime that it's a 3 or a 4, that message will show up. The next question then is, if you take medication for your blood pressure, did you take it today? If you're not taking blood pressure medication at this time, answer no. I'm going to say no. Date that I last saw my provider, and I'm just going to go ahead and put in a different date. And then here is an opportunity for the client to enter a note to their health coach. Wasn't feeling well today. Blood pressure cuff at Walgreens, I think, was broken. I don't know. So that could be a note, like I said, to the health coach. And anytime that there is correspondence back and forth from the client to the health coach, that's going to be here in this notes history. So that'll just kind of keep a running log of what that communication is and has been. The other thing that's included in this, or on this particular page, are links. And these links are just education in nature. So blood pressure measurement instructions, understanding your blood pressure readings, monitoring your blood pressure at home, and when you should call 911 for high blood pressure. Again, like I said, these are all links. They go to American Heart Association information. And then there's also this, I guess, category table that will always be here as well. That just kind of shows them the normal up to the hypertensive crisis. The next question then is, would you like to continue blood pressure tracking? And this will be very, very important for you to have a conversation with your clients that you're talking to, that every time that they put in a blood pressure, if they select yes, they will continue to get the reminders to put in their blood pressures. So we have it set up to every 3 to 4 days, an email will be sent to that client, just kind of like the one that I just showed you that said, just a reminder, put in your blood pressure, here's a link, and then it goes to this page where they can enter their blood pressures and send communication back and forth to the health coach. Anytime that they would put no, that's basically going to opt them out of this tracking system. If you do have a client that does push no on this and submits it, you as a health coach will get a note that says this client opted out and basically said no. So you may want to follow up with them that they did that either on purpose or maybe they did it by accident. Anytime that they do push no and they submit it, and let's say a week later they're like, oh, you know what, I didn't really mean to do that. They would need to go through and enter all of their demographic information again and basically restart a client case. So for this purpose, I'm going to put yes and hit next page. And this basically is a message that just says once you hit submit, your blood pressure readings will go to a health coach. If necessary, your assigned health coach will provide you with feedback. You'll receive a new link every 3 to 4 days so that you can continue to enter your blood pressures in the tracking system. And like I said once before, we do have it set up that a new link gets sent out to the client every 3 to 4 days for up to 12 weeks. Once the client hits submit, they will just basically get a review of their blood pressure readings. So let's say this is the 5th week that they've been doing it. They'll have lots of readings in here that they can look at over a period of time. Close the survey. We do have it also set up that as a client, every time that I enter in my blood pressures, I'm going to get an email that says results. This is something that they can either, and again, just like the table that we just looked at, it'll have all of the blood pressures that they've entered over a period of time. And they will be able then to either forward this or print it off and for their providers if they want, or they can, compile it and bring it to their health coach or something like that. So it is really for their purposes that they get these results. All right. So as a health coach, I'm going to show you this here. So if I switch my hat now, I'm not a client anymore. I'm a health coach. I'm going to get an email every time that a client enters their or submits their blood pressures. And it's going to say, please review blood pressure readings for this particular client. And then you're going to just click on the link. And what will come open is please review and add any notes to the client. This notes from administration, that's going to be, if you remember right, when the central office assigns a health coach to that client, I was able to put in a note to the health coach. Those notes would show up here in the notes from administration. If there's no notes entered, there won't be anything here. We did also add a feature that says client medit number. So if the client is an Every Woman Matters client, Every Woman Matters clients all have a special medit number that is specific to them. So what we will want you to do is if this client, Tracy Test 2, Bono Test 2, is a medit client, an Every Woman Matters client, you'll enter her medit number here. So that way, when we do any data extraction or data comparisons, we can kind of tie this particular monitoring system to our medit system, which will be very, very helpful. Let's say the client is not an Every Woman Matters client, and let's say you're a clinic and you're just using this for clinic purposes. Like I said, they may not have a medit number. So then what you'll do is you'll make up an arbitrary number for your clinic. So if I'm clinic, I might say that I'm clinic A, and this is the number that I'm going to give the client, 123. And then the next client that comes in that's not an Every Woman Matters client, I'll again say clinic A, 124. So it really will be up to the clinic to kind of keep a running log of those clients that are not an Every Woman Matters client. Again, this just gives a running log of all of the blood pressures entered over a period of time. It'll also give you those category statuses, 2 and 3. And I believe this one was a test 1 that I did earlier. So again, I think the last one I did was a 3 and a 4. So those would have shown up there. There's an opportunity here for the health coach to enter a note to the client. It could be a resource. It could be make sure you drink water before you take your blood pressure. Please call your provider if the next blood pressure is a category 3 or 4. So this again is a note from the health coach to the client. Again, kind of similar to the blood pressure on the client side, it kind of keeps this running notes history. So here's a note, wasn't feeling well, also problems with the cuffs. Once you submit this information here that you put will be added to this notes history. And right here, you said, please call your provider if the next blood pressure is a category 3 or 4. If you did make a referral for this client to see their healthcare provider, you can go ahead and click that box. You're then going to hit next page. And then you're going to submit. And then that information is going to be sent to the client. They will then receive that information when they go and open up the next link in 3 days once they enter the next blood pressure reading. And that is the blood pressure tracker. We have it set up as events. That was the other thing. You'll see, so like if this is like the 5th time that they've entered over a period of 3 weeks, it'll say blood pressure reading event 5 or event 6. We have it set up so that there is upwards of, I think, 30 events over a period of 12 weeks. So you'll just be able, that event 1 is just the indication of how many times they've entered their blood pressure reading. Those are the results. And again, this is just an example of what we just talked about, assigning that Medit number and the list, notes, made the referral. All right. And that is the blood pressure tracker monitoring system. If you guys have any questions whatsoever, you can certainly call our central office at 1-800-532-2227. You can ask for Tracy or Natalie Kingston. What you can do is start using this monitoring system at any time. We will be monitoring the emails that come in, and we'll be assigning the clients that come in to the appropriate health coaches. We hope that this is a tool that gets utilized and used how it should, and helps client monitor their blood pressure over a period of time. All right, and I think we are done